Are you ready for more lecture? Well, I wanted to clarify that because somebody asked that all of these current videos that I'm doing where I'm talking about the rhinovirus, the adenovirus, and so forth, these viruses are not types of coronaviruses, but they are other respiratory viruses. They are unique other respiratory viruses, and each of those viruses has many subtypes or other types or within that particular genus or species or that category. We're just going to use the word category because genus, species, all of these words are something that we use in the taxonomy or the naming system of viruses, and I don't even want to get into that today. That's not part of this year's class. So getting into this class and this video for today, we are going to so I'm basically talking about all of the respiratory viruses right now because I know you really want to know about the coronavirus. And if you watch the news, you're seeing a lot of discussion and a lot of news anchors, doctors, CDC, World Health Organization people talking about the coronavirus and how bad it is, how it spreads, all of the above. I'm not here to give you the details. I'm not the news, okay? I am not the news. I don't know. I'm going to let you figure that out. I'm just a doctor who's trying to give you good information to help you give a good life, to live a good life. So, let's get into the next topic. Adenovirus. How bad is adenovirus infection? Well, we know that it's going to cause runny nose, cough, upper respiratory symptoms, and some cases lower respiratory symptoms. The adenoviruses, by and large, do not cause serious infections, but there are some cases where the infections caused by adenovirus can be extremely bad. We talked about meningitis. We talked about keratoconjunctivitis or conjunctivitis, infection in the eyes. We'd also talked about gastroenteritis, but then we mentioned hemorrhagic cystitis, which is bleeding or blood coming from your bladder. Those are a little bit more involved variations of an adenovirus infection, which are worse. And yes, people can die of adenovirus. People can actually even die of the common cold, meaning the rhinovirus, but it's not very common, okay? Today, we're going to talk about the Parainfluenza virus, which is basically a virus that is somewhat similar to the influenza virus. It was identified 50 plus years ago, and the researchers decided to call it Parainfluenza, which means kind of like next to or similar to the influenza virus in some way, shapes, and forms, which in this class we're not going to get into because I don't want to bore you. But the parainfluenza virus is about, 150 to 200 nanometers. Again, remember, these measurements that I'm telling you, they're going to become really important when we start to talk about the N95 mask and the particle filtration that the mask can achieve. So the parainfluenza virus, 150 to 200 nanometers. Okay. This virus does have a third or an outer lipid envelope. And remember in the video, a couple videos ago, where I was talking about how the viral particles, they kind of come out of the cell and they take part of the cell wall with them to create the new viral particles. Well, that's what this virus definitely does. Parainfluenza virus does that. Usually, if you are exposed to somebody who has an active infection, you may get sick within a couple days to maybe a week. All right. And again, this virus is found in animals. Let's see. Some of the animals you can find the parainfluenza. Some of the animals you can find the parainfluenza virus in. Okay, I don't even know if I'm going to edit that out because it is tricky to say that word, okay? Cows, pigs, bats. Remember how we found, or there's this notion that the coronavirus that we're currently worried about, came from bats, which then spread to pangolins, and then, now to people. Well, guess what? Parainfluenza virus also came from bats. Were those bats from China, or were they from America, or were they from another country? Be kind to your brother and sister. Pick that up, okay? We also see it in other animals. Hamsters. How many of you has a pet hamster at home? A guinea pig? Or I actually know somebody that has a ferret. These are not normal animals, but I am not going to judge you for the animal you decide to call a pet. I just want you to be aware that the animal you decide to call a pet could have an infection that you could get. The animal you decide to call a pet could be harboring an infection that you could get. You can sing that one if you want to. Okay, so the symptoms of a parainfluenza... I gotta learn how to say this. The symptoms of a parainfluenza virus are fever, runny nose, nasal congestion, sore throat, cough, sneezing, shortness of breath, and chest pain. Now it's getting hot in here. We're going outside. We're going outside of the car. So, yes, today your classroom is outside. All right. Okay, parainfluenza virus. Most commonly, you will see this virus in children. I see this virus every single year, particularly in the winter time, and I see it in children, usually under the age of 5, who come in coughing with a cough that kind of sounds like a bark. I wish I could replicate that barking noise, but I can't. One of these days I will encounter a patient in the ER, and I'll ask the parents and I'll videotape it. I'll get you an actual video of someone with Croup. It's going to be a child under the age of 5, and they're going to have this funny cough that all the books and teachers say it sounds like a seal barking, but I don't really think it sounds like a seal barking, but it does sound like a different kind of a bark. And that bark I will show you soon. Anyway, this infection, Croup, C-R-O-U-P, is a very common cause of parainfluenza commonly causes this in young children. They come to see me in the emergency room because the kids sometimes are having a hard time breathing. That particular infection affects this part of the kid, the larynx and the structures, airway structures in the neck. Now the infection can go lower than that, but typically when I see them in the emergency room, that's what's going on. The infection is in that region. And those kids, we usually give them a couple medications. I'm not going to tell you the medications because you're not well, some of you might be doctors, and if you are, you know what the medications are. If you're not, and your kid has this funny barking cough and you think he's having trouble breathing, well, you better come to the emergency room and see me or whoever's on duty, okay? This is a little interesting factoid that I know you're gonna love. Because the parainfluenza virus has a lipid outer layer, hand sanitizer does work on this virus. Yes, it does. The CDC is currently recommending 60 to 95% alcohol-based hand sanitizer, and that hand sanitizer does work on a parainfluenza virus. Wow, I said it right the first time. Something else very unique, well, I don't think it's unique about this virus, but this is something that I've been preaching for years. I've been preaching that if you keep your body warm, you have a lower likelihood of getting these infections. Rhinovirus, adenovirus, parainfluenza virus, the other viruses I'm about to tell you about in the upcoming videos. I've always said that, and I've always felt that way, but now we actually have documented evidence that shows that with a temperature above 37 degrees Celsius or 98.6 degrees Fahrenheit, the parainfluenza virus has a hard time staying active. Remember, viruses are not alive, so I can't really say that at 98.6 degrees the virus is alive, but it's less active. If you were to heat it even more, it would completely inactivate the virus. So does staying in a warm room or a warm environment, or maybe being in the Sahara Desert, reduce your chances of getting a parainfluenza virus? Yes, it does. Should you always keep yourself really, really hot because you're afraid to get sick? I'm not going to answer that question, but I'm going to let you decide what you want to do. But just be reasonable with whatever decisions you make. Other risk factors for a parainfluenza virus are malnutrition, vitamin A deficiency, and also lack of breastfeeding. Remember, most of the people who get parainfluenza virus are children under the age of 5. So enough doctors have been around checking this for enough years to know that children who are not breastfed have a higher risk of getting this infection. And then we also talked about vitamin A deficiency. Well, what is a good source of vitamin A? You want to know a good source of vitamin A? I'm going to show you right now. This is a good source of vitamin A. Yes, does eating spinach, something that obviously you can tell I do because I've got it in the car, does eating spinach help to reduce your chances of getting a parainfluenza viral infection? Yes. It totally does. Oh, I'm eating my own hair. That's great. Yeah, it totally does. So keep that in mind. Be smart, be wise, be healthy.